Greetings from the Uganda Cancer Society, and I hope you're keeping safe during this COVID-19 period. I want to make it categorically clear and state that cancer is among the conditions that are vulnerable during this particular time. And so we must be very, very clear on the fact that cancer patients should be among the priority. Now, we want to note with very great concern the fact that we do have got a number of challenges cancer patients are currently facing. And to begin with, one, we know that there is a number of patients at the Uganda Cancer Institute that have been discharged, but they cannot go home because of the lockdown, because of the COVID crisis, and of course the transportation guidelines, which are all very important for combating COVID-19. However, this has now made it very difficult for these patients to reach to their homes, and they are staying within the verandas of Uganda Cancer Institute. The crowds are not good in as far as COVID spread is concerned. And so this is a risk, but also these patients, the accommodation is not safe, as well as they're struggling with meals. As we know, most of the places where the canteens were selling, as well as calorie market, are actually closed. So these people actually basically are cornered.
Yeah, I'm called Betty. I'm from Kitgum district. I'm here in Cancer Institute for cancer treatment. I completed my treatment. They discharged me to go home, but there's no way to leave because of this COVID-19.
I am from Tororo. I was sick. I was getting my treatment at Mulago, but by now I have finished getting treatment. I don't have a way going back, and I have left my children alone at home.
The name is Sarah from Amuria district. I am in the hospital in Mulago. We have finished getting our treatment. We want to go back home. There is no way to go back. The roads are closed.
Secondly, I must note that there are also cancer patients who are in the different districts of Uganda. They are also stuck. They cannot come to Cancer Institute to actually receive their treatment. Those as well need to come for their treatment.
My name is Anna Grace. I am a peasant. I come from Onyakelo village, Mukongoro sub-county, Kumi district. I am a caregiver to my father. So we have been accessing treatment from Mulago Cancer Institute. Now, because of this corona issue, we are not able to access the treatment. We cannot access transport back to Cancer Institute. Otherwise, he is a member there, and he has a number 3348. The record can be checked.
The other issue is the issue of the patient hostels. The patient hostels and palliative care unit, the hospices, are also stuck with the same issue of transportation. The hostels provide free accommodation, meals, and all this kind of support to cancer patients, but also they provide transport support for them to come to Cancer Institute and actually see their doctors, get treatment, and go back, to the hostels. Now, the hostels don't have permission to move their vehicles to bring these patients to Cancer Institute. And so we want to make very strong appeals to government. First, we believe that integration can be taken as a very strong approach and solution, ensuring that as much as we are maintaining COVID-19, which we must maintain as the primary focus for the country, we must also ensure that there is integration of the care of cancer patients such that they are not left behind. Number two, we also want to appeal that these cancer patients who are crowded at Uganda Cancer Institute, discharged and able to reach home, should be supported. We must come up with mechanisms to ensure that these over 130 patients stuck at Uganda Cancer Institute in that crisis are supported and actually ensured that they reach their homes. Number three is that we want to make sure that all the cancer hostels are looked at as priority for provision of stickers, vehicle stickers, to actually enable them move the patients to the Cancer Institute to see the doctors such that their treatment can continue. As we are all well aware, consistency in the treatment of cancer is very key for better outcomes. The other one is that we want to appeal that Also, the cancer doctors and health workers at Uganda Cancer Institute are provided with the same vehicle stickers that the task force is giving out to enable them to come to work. Then the other issue is that I want to make a very, very general appeal to the overall public. So for those people of good hearts, who can come and work with us to look for solutions, to support, to provide funds, to arrange for transportation of these very stuck patients at Uganda Cancer Institute, please come forward. Come and work with Uganda Cancer Society such that we can actually ensure that together with government and all other stakeholders, we can help these cancer patients and find solutions in the process of trying to integrate national response on COVID and the care of cancer patients, ensuring that they are also not left behind. Now, we want to thank the government, the pragmatic leadership of the president in leading the nation during this particular period. But also for those who are still in quarantine, we want to really appeal to you to continue to be obedient as following the instructions of the ministry, such that you continue to keep yourselves, your loved ones, the community and the country at large safe. I can assure you this obedience is the utmost expression of patriotism in you. In that way, we will all remain safe, and I'm sure that this particular COVID-19 issue will soon be a matter of history in our country and perhaps the world over.